such kind of circumstances, then you think that there are lots of females and they can contribute a lot for Pakistan. Due to such kind of circumstances, they cannot.
I think that is right, and the environment is not congenial to their effective contributions. They are very, very smart and well educated and capable ladies in this country, and we know that the female male ratio is 55:45 in this country, and when you put that ratio into numbers and the number of educated women who are much less than men, but if you see, then it is a loss to the country and to the nation.
Gender discrimination, do you think that it's only that exists in workplaces, or it starts from home? As you mentioned that you have 2 daughters, 2 sons, and then what kind of attitude, looking experiencing all these discriminations, you try to develop their mind so that they really treat each other, something like this?
Well, as far as I am concerned, I have not discriminated between my daughter and my son, and the biggest example I can give you is that my daughter, I didn't want her to become a doctor. The reason being, my mother-in-law didn't want her to be a doctor because she saw my life to be very tough, and she didn't want her life to be tough and demanding. So she said, मैं मरने से पहले नसीहत करूँगी इसको डॉक्टर नहीं बनाना. And keeping that context in life, my daughter was going to one of these model schools, girls model schools in Islamabad, and I said, well, in girl model schools they are very serious studies. The younger one got admission in OPF, and I said, well, OPF is more versatile. My elder daughter also, just for the equality, I've been studying an ICD and she's studying an OPF. So I got her in the class 8th around O levels into OPF. She got admission there, and I did not stop her from going down there. Once my daughter was in OPF, I told her to choose whatever she wanted to, and she did her O levels, and then she said she wants to do A levels and not FSC, because till that time it wasn't decided that she's going to take up medicine. This is my elder daughter who has taken up medicine, and she's training to become a gynecologist now, and at the moment she's in the UK, and she has topped in her university. She became the best graduate. She got 8 golds, 5 silvers, so many distinctions, and when she could not get into the government medical colleges because of her equivalence of A level, she said, even after A level, she said, I want to be a doctor. So when she decided to be a doctor, then we said, okay, yes, you become a doctor, but by that time it was too late because of the equivalence thing to get her into the medical colleges, and she could not make that. Then seeing her interest, we thought, okay, let's send her to a private medical college. For a minute I thought I'll have to pay, and then for the second time I thought, well, I'm thinking I'll have to pay. If it was a boy, if it was because my elder son was going to RMC, a public medical college. If it was a boy, I could have, I would have not said that. I wouldn't have thought for a minute that I'll have to pay, and because this is a girl, I'm thinking like that, then I told myself, no, she will go to the medical college and we'll pay for her. And mashallah, throughout she got scholarship, and she got back what we were paying for her. So she's mashallah doing very well. So I feel that being in the society, we do think about these things, but alhamdulillah, I did not put my girls into that circumstances.
So you are working in the critical area, which is the gynecologist area, and then how do you tell us about this? Cases come to you, and you have been working extensively in these areas. The cases because of gender issues that they have at their homes. Means, for example, interaction with the child, for example, and then the female cannot decide whether she wants or not. It's the male. What kind of cases come to you? Those happen because of gender.
Well, quite often when you talk about a woman doesn't want a baby, or the family doesn't want a baby, the man, if he doesn't have to undergo anything physically, he would say, okay, doesn't matter, such and such friend's wife went to such and such person and had a clean up, why don't you go? I mean, the attitude is not quite right. Perhaps when you talk about this unwanted, you're talking about unwanted pregnancy.
Unwanted, or many other areas, maybe.
This is one example, one unwanted pregnancy. Then we do receive women with life-threatening infection and complications and dangers. So there is a woman's role, but there's also a man's responsibility. So that is one thing which socially we must look into and try to tell them the right ways of preventing a woman from that risk of endangering her life. Then in other aspects, it does happen that a woman, the responsibility for example, repeated pregnancies, anemia, women coming with complications, they do come to us with all these problems. The family does not take the responsibility. For example, the husband doesn't take the responsibility of contraception. The woman, or if the woman wants to take, for some taboos and unknown fears, she is not allowed to carry on those.